All right, doctor, then have you seen this increase in the last few years, or are we now hearing more about it because maybe after the pandemic, have we become more conscious about these things?
I think it's to both. In my personal experience, the last 30 years, I have seen the number of young people with heart disease has increased exponentially. That is mainly because of the lifestyle you are leading. Second thing also, the awareness has come up. More and more people know about it. Media is reporting so that you know. Earlier, a lot of people just suddenly used to die, nobody used to know. But more, it is definitely there is an increase in the incidence. Second part is, yes, there has been awareness such that more and more people know. What is concerning is there is a definite increase in incidence. 30 years back when I started my practice, I will see a young patient of 30, 32 probably once in a year. Today I see every day or at least 3-4 times a week.
And what kind of, I mean, are the patients, do they come in for preventive health checkups, or, I mean, are you seeing more awareness even among patients, or how are these patients meeting you? Because what is really driving them?
These are the people who had either symptoms got checked up, so they found heart disease, or people who had gone for a preventive checkup, they found a blockage.
Okay. Now, the Cardiological Society of India says that India is the capital of chronic heart diseases in the world. So, given this background, what do Indians need to do to make sure that, yes, maybe, where we are the chronic heart disease capital, but that does not have to mean a big problem if there are certain things we do.
Yes, I'll give the context to that. 40 years back when I was in med school, our professors used to teach that this disease is a disease of the Western population. Indians never had this disease, and we rarely used to see patients. In 40 years time, I have seen from that situation today, we are the heart disease capital of the world. It's purely because of the lifestyle that change has taken place in last 40 years. When a lifestyle, it is lack of exercise, food habits, stress, and the smoking, tobacco use, all these things has led to a pandemic of heart disease where the people are getting this problem much younger age. And there is some possibly genetic factor where Indians are more prone, but it was not so much 40, 50 years back. So, it is largely to lifestyle related, which again comes to your point that if we really want to change our lifestyle, then this disease can be controlled and it is not a problem.
And what about, we've heard doctors also say that, after 40, assume that you're a heart patient unless the tests tell you otherwise. Is that an approach you agree with?
That is the extreme thing, but I will suggest after 40, everybody should get a checkout. If you ask me, even nowadays, I will say before 40 also. This week only I have operated 2 patients who are 36 years of age with critical heart blockages. So, I will put it this way, after 40 definitely, before 40 anybody who has any apparent risk factors mean there are certain factors if the person has, there is a higher chance the person will get a heart disease like diabetes, blood pressure, strong family history, tobacco use, obesity, high cholesterol. If any of these factors are there, I will suggest somebody to get checked even at the age of 30. I have seen patients 25, 26 getting blockage nowadays. So, earlier I used to say 40, 50, from 50 we said 40. Now I will suggest that 40 for general population, and those who are apparent high risk, they should get it done even 25 to 30 years of age.